MacVoices TV at Macworld 2010 is sponsored by Smile on My Mac, the makers of great productivity software like PDF Pen, Text Expander, and Disk Label. Visit them at smileonmymac.com. This is MacVoices TV back on the show floor at Macworld 2010. I'm Chuck Joyner, and we're in the MacPractice booth talking to Mark Hollis about MacPractice. Mark, it's good to see you again.
Nice to see you, Chuck.
Have you had a good show so far?
Yeah, it's been a great show. I've been very busy in the booth.
Yeah, it seems to be.
As you can see.
Yeah, this is not a bad thing. Not a bad thing.
Right.
It's been a little while since we talked about MacPractice, and so just kind of bring us up to date with what it is and where you're going with it.
Well, as we spoke before, our company develops software for dentists, physicians, chiropractors, and eye doctors. And so what we've done is we've continued to evolve the application, take advantage of all of Apple's new technology. So within about a month, for example, of Snow Leopard's introduction last year, we had our products working on Snow Leopard. We released a version that would do that. We've continued to add new technology that would make it possible for physicians, dentists, and chiropractors to use just a Mac in their office. So we've added, for example, in dentistry, digital sensor drivers so that dentists can have a native solution, as well as having bridges to PC solutions that work on a Mac platform. In electronic medical records, which is that's a hot topic. There's $19 billion that's available from the government for healthcare initiatives. And so we're working as a member of a national organization called the HIMSS, Electronic Health Records Association, to influence what the government's standard is going to be when it comes out sometime in around the June timeframe. And so we're also developing our software to what the expected standard is right now, so that a doctor can use one integrated solution and have an EHR solution that's certified.
Do you think there's any chance that they'll come up with a standard that makes sense for everybody? Because I know different phases of the medical practice seem to have different demands.
Well, I think you ask a very good question.
I don't think that was an answer, but I'm not going to push it.
Well, the document right now for what a doctor has to do in order to be able to receive incentive money from the government is 750 pages.
I didn't know it was that bad. I knew it was staggering, and that to me is where something like MacPractice would shine, because you're in the business. You know, you want to make everything easier for them, and you've developed pretty much a fully featured solution.
I think that basically there's a lot of information about what the standard is, whether the standard is appropriate for a doctor. There are 110 different specialties in medicine. I don't know if you're aware of that many. And then there are many subspecialties in addition. And each one of them collects a different piece of information. The government is really in order to fulfill meaningful use, it appears that only primary care doctors are likely to be able to fulfill that guideline. And that's only about 30% of all the doctors in the United States. But the government hasn't really been completely clear about that, and so all doctors, even specialists, think that they're going to get this money for purchasing electronic health records. Our goal is, of course, to develop for that so that they can qualify by using our software. But our goal is also to make a product that makes sense for them to purchase and use in their practice, regardless of whether they take government money or they fulfill the government standards. So our primary goal is to make them more effective, to give them the flexibility of being able to continue to work the way that they're working or more efficiently, allow them to collect the information that's appropriate and be able to see it wherever they are, instead of having to pay somebody to pull a chart and bring it to them in order to see that information. Allow them to be able to see the information remotely, either using the desktop or perhaps seeing some of the information using an iPhone interface, or in the future an iPad interface that we plan to work on. So our goal is primarily that the application should pay for itself without them having to have the government give them money to buy it. So they could buy. We want them to buy primarily because they would buy anyway, not because the government is giving them money to buy it.
Mark, I think the last time we talked, you had relatively recently brought MacPractice to the iPhone, giving a doctor access to their records, to everything on an iPhone, so that they didn't have to be in the office, like you say, pulling a chart. Where do you see the iPad fitting into the practice of medicine and medical information? a lot of us not in the field would look at this and say, boy, this would just seem like it's tailor-made for the medical industry.
Well, let me clarify. So the iPhone is obviously a very small screen, if you haven't noticed. And so the information that's on the desktop is, although you could see all that information by controlling another computer, it's impractical for most physicians unless they're a specialty and only look at very minimal information. So for the most part, the goal of designing for the iPhone is to give somebody access to just the pertinent information that's appropriate for that screen size, and that will retain the same goal for the iPad. So the iPad is 1024 by 768 in its resolution, and it's supposed to be a beautiful screen. Of course, none of us have one, but it looked like it was beautiful on stage when Steve was presenting it.
And Apple has a history of kind of delivering on a lot of that kind of thing.
Yeah, so we have every reason to think it's going to be a wonderful screen. But but you can't put a desktop application on it. So you have to design, in order to be able to get the user feeling, you need to be able to design your application and develop it from the ground up, specifically for that platform. And that's what we plan to do over a period of time. We're going to take our iPhone interface, and we've already begun to develop it. That's a web application for the iPhone, and virtually any web application is going to work on the iPad as well. But what we're doing is, just like we designed that web application so that it's designed for the iPhone screen, we're designing it now so that it will work for the iPad screen, take advantage of the larger screen.
It's got to be exciting because now you have a whole new platform to work with.
Yes, it is exciting. I have read an article that said that 1 out of 5 doctors is going to buy an iPad. My question is, what exactly do you think they're going to put on it? I don't know. But there's a lot of confusion. Unfortunately, consumers don't understand necessarily that it's not a portable computer. So they assume that whatever they can do on a portable computer, now I can do it on an iPad, and that won't be true.
No, but if you're building it as a web application, then you're only restricted by what you can do in a web application, and that does seem to have a bit more flexibility.
Well, I think so, that's true. But on the other hand, we're, just to be clear, we're doing that, but we're also developing, I don't have a timeline on it, but we also are developing electronic medical records and charting as an iPad application. So we will have, in terms of an interface, we'll have much greater tools that are offered in the SDK to be able to leverage in order to be able to come up with a beautiful application for a dentist, for example, to do dental charting on an iPad. We think that's a great application for dentistry, or for a physician to be able to do electronic medical records or electronic health records. But so we'll have the web application, but we won't have the richness of the interface and be able to take advantage of everything that Apple offers without doing an application as well, an iPad application.
Mark, this may be outside the scope of what we're discussing, but I'm curious because I'm thinking as a consumer of medical services more than a provider. Do you see any opportunity at any point for me to ever have my medical records on a thumb drive or a DVD or something I can take to a doctor's office, hand it to them, and have them imported into MacPractice or whatever they're using, and have my doctor or the doctor have full access to everything?
Well, that's where the government is going. The initiative and the definition of meaningful use includes a requirement in order to fulfill meaningful use that has to do with your having your personal records in some form. Right now, the question is, and that's what we're discussing with the Electronic Health Records Association, with the government. We're giving them our input on this document, and we're talking about, well, what are the variety of ways? Because some doctors may only be able to do it in paper. Some doctors may only be able to do it electronically. Some doctors may pull a CD. And the question is, and then in terms of interacting with the data, that's a future date. That won't happen right away. But that's the direction that the government's moving. And I believe everything with HIPAA and all of the the Obama administration, the Office of the National Coordinator, ONC, their focus is exchanging information and making it possible for the consumer, the patient, to be able to have access to their information, to be able to, for their provider, their doctor, to have access to other doctors' information. But it's going to take a while before that comes. But this is the move in that direction to make that possible.
Well, having recently had some health issues in our family,
Sorry to hear that.
Oh, no. But I guess the point is, I've sat for hours going through filling out medical history forms. I come to you as a Dr. A, and you have your form to fill out. I go to Dr. B, and they want the same information, but it's a different form. And it does become frustrating very quickly when you're dealing with a lot of different specialties that need to be done.
Well, even more so, if you were in a hospital, you probably filled out multiple forms within the hospital itself, and all you did was walk from one floor to another floor.
Exactly, and that's why I'm very interested in just how this is and knowing how good MacPractice is and how far thinking you've been. I would like to see this in a lot more doctors' offices so we can implement some of those standards quicker.
Right. Well, our goal in terms of designing our application is to make it possible to eliminate as much redundancy as we possibly can. I think that we have more flexibility than the hospital, very, very expensive high-end hospital systems that unfortunately a lot of doctors don't report to us that they don't enjoy using. They don't really enjoy using the application. The user experience is not good, and it's complex, and some of them feel that it interferes with their use. But we have the ability in a small doctor's practice, which is our target area, the 160,000 doctors' offices, and one study says that only 5% of them are using electronic medical records. So there's a wide open market. We have about 600 offices of our 3,000 offices that use electronic medical records right now. It's probably a couple of thousand doctors that are using EMR with MacPractice. So we have the ability to be able to focus on what's going to make the office more efficient. That's a doctor. And I think the benefit to a doctor also is that the more efficient they are, the more likely they are to stay in business, the more they can focus on patient care. And that's why I'm concerned about when I mentioned before about the government money and about a doctor buying the software for the right reason, that it makes them more effective. I think it's important for doctors to focus on that, on making a good business decision, not being distracted and possibly making a bad business decision because there's an incentive from the government, a one-time to do that.
And again, as I recall our previous conversation and the capabilities of MacPractice, that was your focus, is to build something from the ground up that really facilitates the practice of medicine, gets as much of the record keeping and paperwork as possible out of the way.
Right. This is something that my partner and I have been doing, Patrick and I have been doing for nearly 30 years. We have over 60 employees in our 12,000 square foot facility in Lincoln, Nebraska, and this is what we wake up to do, is to make doctors more efficient, to come up with creative ways, listening to our customers, using the experience that we have over this period of time to continually enhance and improve the product, to allow doctors to be able to focus on the patient, to be able to provide excellent patient care, and to be able to handle their business as effectively as possible with as little effort as possible.
Mark, I know that your pricing scheme is all over the place. For the doctors that are watching, and hopefully we've intrigued some of them, come and check you out, what's the best way for them to get the information they need?
The best way is to go to MacPractice.com, register at our website. Take a look there's a lot of information about our products at MacPractice.com, and when they register, they'll get a username and password in an email from me that will give them access to the QuickTime movies of the application. Probably about 85 to 90% of our customers that currently own our software, that's the path that they took. We have 40 representatives throughout the United States. So we basically get in the loop. We're doing a lot of events in Apple stores, MacPractice events in Apple stores. So they may want to look at our events page and see where we might be doing events. We also probably do about 100 trade shows a year, both medical and dental. So there's lots of ways to be able to see our product, and we'd love to have them come and take a look at the QuickTime movies and take a look at our product and consider us. We have an excellent product in the marketplace, and it compares favorably to every product on all platforms.
The first time we met was at Macworld, and I found it intriguing to have something this specialized at what a lot of people see as a general interest kind of show. And yet every time I come by the MacPractice booth, anytime, it's always jammed with people. So there's a lot of interest here, I guess, on a lot of levels, and a lot of medical professionals that come to these shows and need and want this information.
Yes. Well, I think there are professionals coming here, but just like you said, how many doctors do you know that you saw, unfortunately, with your family? So there are also many people that are here that are here looking for software for a friend, for a relative, for a business associate, for a client, and that's what we're here both developing relationships with consultants, people who know somebody and they're just looking for software for a doctor, and also end users, potential users of our software.
Mark, it's good to see you. I hope you'll come back as things develop, and maybe you can enlighten us a little more once the government regulations get at least finalized or closer to finalization.
Well, I'd love to do that. That would be wonderful.
Good to see you. Take care. Thank you.
Thank you.
Folks, right now, write down on a piece of paper for your next doctor's appointment, MacPractice.com. Tell them to go and check it out because it'll make your life easier if we can get some of this stuff done. I'm Chuck Joyner. This is MacVoices TV on the show floor at Macworld 2010. More soon. Thanks for watching. MacVoices TV at Macworld 2010 is sponsored by Smile on My Mac, the makers of great productivity software like PDF Pen, Text Expander, and Disk Label. Visit them at smileonmymac.com. MacVoices TV is part of the MacVoices Group and a member of Mac Level 10.